السلام عليكم، معكم الدكتورة إسراء لكلوك. اليوم رح نتكلم عن المحاضرة الثانية من Male Genital Tract Pathology lecture series. Lecture number 2 is about testis and epididymis pathology. محاضرة اليوم رح تتكون من 5 topics starting with congenital anomalies of testicle, inflammation and infectious disorder involving testis and epididymis, vascular disorders, lesions of tunica vaginalis. Finally, we'll end our talk with testicular tumors. أول جزء في محاضرة اليوم اللي هو congenital abnormalities of testicle. أول موضوع رح نتكلم عليه اليوم اللي هو الكريبتوركايتيزم. الكريبتوركايتيزم هذا موضوع مهم جدا بالنسبة للامتحان وفي الكلينيكال براكتس. شن تعريف الكريبتوركايتيزم؟ تعريف الكريبتوركايتيزم هو failure of testicle to descend into the scrotal sac. الفيلير هذا ممكن يكون complete or partial. باش نفهموا الباثوجينيسيس اوف كريبتوركايتيزم لازم نراجعوا جانب من التستيكولار امبريوجينيسيس during the fetal life. في هذه الصورة ممكن نوضح لكم الامبريوجينيسيس of testicle, specifically the pathway of migration of testicle from the abdominal cavity to the scrotal sac. يعني بصورة مبسطة الجونادز they develop inside the abdominal cavity. في الفيميل الجونادز they will differentiate to ovarian tissue. بالنسبة للميل الجونادز they will differentiate to testicular tissue. بالنسبة للفيميل الأوفريز they will stay inside the abdominal cavity، لكن الحالة مختلفة بالنسبة للميل. specifically for the testicular tissue the testicular tissue لازم يطلع من الابدومينال كافيتي، اللي هو من هنا لازم يطلع من الابدومينال كافيتي وينزل للسكروتال ساك. عملية النزول هذه تصير عن طريق الانجوينال كانال، واي خطأ او خلل في عملية المايجريشن ممكن تؤدي الى كريبتوركايتيزم. وعلاش هذه حاجة مهمة بالنسبة للتستيكولار تيشو؟ التستيكولار تيشو ما يقدرش يقعد في درجة حرارة الجسم اللي هي 37. الجيرم cells of testicles they should stay in less than 37 degrees Celsius to preserve the functionality of germ cells. يعني هذا مهم جدا. الجيرم cells لازم يكونوا في درجة حرارة أقل من 37 اللي هي في سكروتم. درجة الحرارة تكون تقريبا 36 ل 35 درجة مئوية. هذه باش نحافظوا على integrity and functionality of seminiferous tubule and germ cells to produce sperm during the adulthood. The failure of migration can be intra-abdominal. في هذه الحالة نقولوا لها abdominal cryptorchidism. الفيلير لو يصير في الانجوينال كانال بنسموه inguinal cryptorchidism. الفيلير مرات يصير في مستوى السكروتم، في هذه الحالة نسموها suprascrotal. لو كان الفيلير صار برا الانجوينال كانال بارتواي راح نقولوا له اكتوبيك كريبتوركايتيزم. في points مهمات لازم نعرفوها على كريبتوركايتيزم. كريبتوركايتيزم is the most common congenital anomalies في الميل reproductive system، وممكن نشوفوها حوالي 1% of 1 years old male infant. الكريبتوركايتيزم can be unilateral وإلا bilateral. Most of the cases will descend in the scrotal cavity by age of 2. الحالات اللي ما يصير لهاش نزول by age of 2 هدوماي لازم يصير لهم تدخل جراحي وعملية التصحيح اسمها أوركوبكسي. أوركوبكسي معناها تثبيت الخصية في السكروتال ساك. الكريبتوركايتيزم can untreated cases can cause tubular atrophy and sterility اللي هو العقم. untreated cases also increase risk of testicular cancer اللي هو نوع من الجيرم سيل تيومر specifically السيمينوما. بالنسبة للماكروسكوبيك مورفولوجي للكريبتوركايتيزم التستيكل حيكونوا small and firm لأنهم atrophied. شنو هو الهيستولوجي of the cryptorchidism؟ باش نفهموا الهيستولوجي of the cryptorchidism لازم نفهموا الهيستولوجي of the normal testis. The normal testis composed of seminiferous tubule and interstitium tissue. هذا الانترستيشيم tissue. السيمينيفرس tubule من اسمها it's a tube has wall وإلا basement membrane and luminal cells. هذا luminal cells. luminal cells are two type of cells: supporting cells اللي هم السيرتولي cells، والسيلز الثانيات اللي هم الدارك بلو cells هدول اللي نشوف فيهم هنا يبدو large at the basement membrane and they get smaller at the lumen at the center of the lumen. هدول هم الجيرم cells. هم الجيرم cells. والتشينج في المورفولوجي from large to small هذا اللي نقولوا لها احنا spermatogenesis. they get like this toward the maturation. spermatid يعني نشوفوهم هدول هم عبارة عن spermatids. كمقارنة بالنسبة للتستيكولار اتروفي في الكريبتوركايتيزم الهيستولوجي تقريبا مختلف، يعني نقدر نلاحظ الاختلاف. عندنا seminiferous tubule shows very thick basement membrane. We have only Sertoli cells, those supporting cells here, and مفيش germ cells and there is no spermatogenesis. بالنسبة للinterstitial component, testicular interstitium composed of those islands of polygonal cells with round nucleus, prominent nucleoli. هدول السيلز نقول لهم Leydig cells. في الاتروفيك atrophic testicular of cryptorchidisms عندنا increased number of Leydig cells or Leydig cells hyperplasia. يعني to summarize the findings in the cryptorchidism histology, seminiferous tubules shows Sertoli cells only, no germ cell, no spermatogenesis, thickening of basement membrane, increase in interstitial Leydig cells or Leydig cells hyperplasia. Second part of this lecture is inflammation and infection of testicle and paratesticular tissue. Infectious epididymitis and orchitis can caused by different pathogens. نقدر نقسموهم على حسب patient age. In childhood, the most common organisms are gram-negative rods and Mombus virus. For sexually active men younger than 35, sexually transmitted disease including chlamydia trachomatis and Neisseria gonorrhea. بالنسبة للmen older than 35, the most common organism will be the urinary tract pathogens including E. coli and Pseudomonas. In this slide, we will demonstrate the gross findings of acute epididymitis and adjacent acute orchitis. في الصورة هذه زي ما نشوفوا عندنا cross section of epididymis and cross section of testicle. Epididymal structure is entirely replaced by friable tan white material with focal greenish discoloration and focal hemorrhage. This like whitish area extending to the adjacent soft tissue. بالنسبة لل testicle, the parenchyma of the testicle is congested. There's multiple foci of whitish friable material replacing the testicular parenchyma. Those whitish discoloration representing an abscess formation in the epididymis and in the testicular parenchyma. آخر topic في inflammation and infectious process رح نتكلم على orchitis, infectious cases and non-infectious condition اللي هي autoimmune orchitis. نبدأ بالمامبس orchitis. Mombus orchitis caused by Mombus virus, usually affecting school-aged children, causing acute interstitial orchitis, accompanied with the swelling of parotid glands and pancreatitis. بالنسبة للtuberculosis orchitis or mycobacterium orchitis, it's caused by mycobacterium and usually started with epididymis infection, epididymitis, then spread to the testicle. The morphologic or histologic pattern of tuberculosis, as we know, it's necrotizing, caseating granulomatous inflammation and those granulomas will be positive for acid-fast bacilli. النوع الثالث من الأوركايتس رح نتكلم عليه اليوم اللي هو السيفلس. السيفلس can affect testicle and epididymis at the same time, can be acquired and congenital. وبالنسبة للهistology there is two pattern of morphology اللي هو endarthritis with perivascular cuff of lymphocyte and plasma cells and granulomatous inflammation اللي هي نعرفوها باسم الجاما. النوع الثالث من granulomatous inflammation اللي كان نقدر نشوفه في التستيكولار تيشو اللي هو الأوتوميون أوركايتس. Autoimmune orchitis, it's idiopathic systemic inflammatory conditions characteristic by non-caseating granulomatous inflammation or non-necrotizing granulomatous inflammation. وهذه inflammatory conditions will be negative for acid-fast bacilli. ثالث توبيك رح نتكلم عليه في محاضرة اليوم اللي هم vascular disorder of testicular tissue. testicular torsion. testicular torsion من الاسم نفهمه إنها torsion معناها twisting. This is very high yield topic and it's very important for the exam and for the clinical practice. Testicular torsion is twisting of spermatic cord lead to hemorrhagic testicular infarction. هذه مهمة. hemorrhagic testicular infarction. cause of this condition, it's a congenital failure to testis to attach to the inner lining of the scrotum. يعني التستيكل عبارة عن organ freely mobile inside the scrotum. It's not attached or adhesed to the inner surface of the scrotum. باش نفهموا الباثوجينيسيس concept of hemorrhagic testicular infarction due to the testicular torsion لازم نفهموا basic concept. عندنا spermatic cord فيها blood in from the artery, this spermatic artery or testicular artery, and blood out through the vein. والtesticle it's attached to the spermatic cord. Twisting around the spermatic cord lead to collapse of the thin-walled vein and keep patent the artery. So the collapse of the vein prevent the appropriate venous drainage and continuous blood flow from the artery. يعني continuous blood flow from the artery without appropriate venous drainage will prevent appropriate perfusion to the tissue across the tissue. The continuous blood flow lead to hemorrhagic testicular infarction. لأن حتى لو كان في continuous blood flow from the artery لكن without the appropriate drainage معناتها ما فيش good perfusion and continuous blood supply or blood flow from the artery will lead to hemorrhagic infarction. The clinical presentation of torsion testis is a sudden pain with testicular or scrotum swelling in absence of cremasteric muscles. This is a gross picture of testicle, epididymis, and spermatic cord. Shows black discoloration of epididymis and testicle, and the cross section shows like complete infarcted testicular tissue and complete infarcted epididymis with marked hemorrhage and necrosis. This is epididymis and this is testicle. Next topic from the vascular disorder of the testicle is a varicocele. شنو هو الvaricocele? Varicocele is dilated spermatic vein due to impaired drainage distally. يعني هذا عندنا احنا spermatic cord, blood in from the artery, blood out from the vein. Any blockage distally can lead to dilated and torsion of the spermatic veins. The presentation usually asymptomatic. Also, it's common in infertile men. Clinical findings: scrotal swelling with bag form. يعني زي ما نشوفوا احنا عندنا dilated and torsioned veins هادو هما اللي يكونوا يديروا representation of bag of worm. Can usually left-sided, also can be associated with left-sided renal cell carcinoma. Correction, surgical repair. Next topic will be lesion of tunica vaginalis. hydrocele. hydrocele عبارة عن كلمتين. hydro mean fluid and cele is scrotum. It's a collection of serous fluid within tunica vaginalis. السبب هو عبارة عن incomplete closure of processus vaginalis. هذا ديما بيكون موجود في الانفانتس. ببساطة عندنا هذا spermatocord وهذا التستيكل وهذا السكروتم. السكروتم عنده continuation مع البروتونيال cavity. The fluid they will escape from the peritoneal cavity into the scrotum due to failure of the closure of processus vaginalis, and they can present with a swollen. بالنسبة للأدلت يكون السبب إن هو blockage of lymphatic drainage زي في infectious condition with filariasis. The clinical presentation scrotal swelling, and this swelling is transilluminated. الجزء الأخير من المحاضرة اليوم اللي هو testicular tumor. راح نتكلم على basic concepts about the testicular tumor. Testicular tumor arise from germ cells or sex-cord stroma. Clinical presentation usually firm, painless testicular mass that cannot be transilluminated. Transillumination was positive في الهيدروسيل. لكن في testicular tumor those swelling cannot be transilluminated. يعني any transilluminated lesion usually are benign or non-neoplastic process. Non-transilluminated scrotal swelling, think about neoplasm or masses. Testicular tumor cannot be biopsied due to risk of seed scrotum. Treated with radical orchiectomy. راح نتكلموا على النوع الأول من testicular tumor اللي هما germ cell tumor. Germ cell tumor are the most common type of testicular tumor, usually occur between age of 15 and 40. It's like young adult men are the most common affected by germ cell tumor. The risk factor is cryptochromosome and Klinefelter syndrome. All germ cell tumor are malignant. All germ cell tumor are malignant, including mature teratoma. Mature teratoma في الفيميل are benign. Mature teratoma في testicles are malignant. لازم نفرق ما بين السيمينوما and non-seminoma germ cell tumor لأن السيمينوما has better prognosis and it's respond to radiotherapy. النون-seminoma اللي هما including اليوكساك tumor, embryonal carcinoma, teratoma, and choriocarcinoma. Those are has more aggressive behavior and they don't respond to radiotherapy. Germ cell tumor, they are divided based on the type of tumor tissue production. So we can divide them as if the tumor produce mature fetal tissue, had a tumor we will call teratoma. If the tumor produce embryo-like tissue, this carcinoma will be embryonal carcinoma. If the tumor produce placenta-like tissue, this tumor will be choriocarcinoma. If the tumor produce yolk sac-like tissue, this will be a yolk sac tumor. If the tumor produce germ cell-like tissue, forming like sperm-like, this tumor will be seminoma. Seminoma, نفس الtumor arise in the ovary, we call it dysgerminoma. So dysgerminoma, it's a counterpart of the seminoma in the ovarian tissue. Seminoma is the most common malignant of testicular germ cell tumor, accounting 50% of all germ cell tumor. The peak incidence in the 4th decade. Serum marker, هذه نقطة مهمة. Serum LDH may be elevated. beta HCG may be elevated. Alpha phenetoprotein usually normal, should be normal. Seminoma has good prognosis, respond to radiotherapy. Morphologic feature of seminoma. Seminoma is well circumscribed, homogeneous gray-white cut surface, no hemorrhage, no necrosis. هذه cross section of testicular seminoma. This is testicle, and this is the tumor. The tumor is well circumscribed, tan white, homogeneous with no necrosis or hemorrhage. And this is the normal adjacent parenchyma of testicular tissue. بالنسبة للميكروسكوبيك findings زي ما نشوفوا هنا هذه low power view of testicular tissue. هذه testicular parenchyma وهذا tumor. Tumor is well circumscribed and stand out from the adjacent tissue. In another focus of testicular seminoma. Seminoma, it's lobulated and divided by those thin fibrous septation. يعني واضحات من low power. We have a prominent lymphoid aggregate. هذه medium power view of seminoma shows lobules of tumor cells evenly distributed. There is no overlapping between the nucleoli. يعني cells well distributed, ما فيش النيوكلياي مش جايات فوق بعضهم. Clear cytoplasm, this is a clear cytoplasm, and prominent lymphoid infiltrate. And this is the fibrous septation. High power view shows like lobules of tumor cells with polygonal cells with distinct cell border and evenly distributed nucleoli without overlapping. Or we scattered lymphocyte there, here and there. So, summary of the microscopic findings: fibrous septa, divided sheets of tumor cells into lobules زي ما شفناهم في low power. Tumor nests composed of large round tumor cells with abundant clear cytoplasm. Tumor cells are evenly separate without nuclear overlap, prominent cytoplasmic membrane, and lymphoplasmacytic infiltrate. النوع الثاني من germ cell tumor اللي هو الembryonal carcinoma. The second most common pure testicular germ cell tumor after seminoma. يعني أكتر the most common germ cell tumor اللي هو السيمينوما. النوع الثاني اللي هو الembryonal carcinoma. Embryonal carcinoma it's resemble embryonal or embryonic tissue يعني زي نسيج الامبريو. Age between 15 to 35 years old, 10 years younger than patient with seminoma. Microscopic, poorly circumscribed mass with frequent extension into the testis, variegated morphology with large area of necrosis and hemorrhage. يعني لازم نشوف differences between السيمينوما and embryonal carcinoma. السيمينوما well circumscribed, tan white, homogeneous, no necrosis, no hemorrhage. لما في الجروس picture نشوفوا إن التيومر poorly differentiated in extension to the testis or infiltrating adjacent structure, different morphology on the cut surface with area of hemorrhage and necrosis. لازم we should consider embryonal carcinoma in the differential diagnosis. زي ما نشوف الصورة هنا هذه testicle، هذا النورمال parenchyma، هذه النورمال compressed normal parenchyma، وهذا التيومر عنده variegated appearance, different color and morphology, area of congestion and hemorrhage, and the black dots is necrosis. This is also necrosis, hemorrhage and necrosis. Microscopically, this is low power view. This is the uninvolved testicular parenchyma وهذا التيومر. هذا التيومر اللي هي الامبريونال كارسينوما وهذا testicular parenchyma. We can appreciate from this power area of necrosis. The tumor looks shows like papillary proliferation with gland space-like formation. This is a medium power view showing papillary proliferation or gland-like structure. The cells are very pleomorphic with hyperchromasia, frequent apoptosis, overlapping between the nucleoli, some elongated nuclei as well. يعني we can appreciate the difference in the histology between السيمينوما and embryonal carcinoma. Seminoma looks more ugly, high pleomorphism, frequent mitosis, indistinct cell border, كل هدول mitosis, and apoptosis associated also with necrosis and the nuclear overlapping. Another picture showing highly pleomorphic tumor with gland-like structure and papillary-like structure, highly pleomorphic cells with prominent nucleoli overlapping and frequent mitosis. Microscopic summary: embryonal carcinoma usually undifferentiated cells of epithelial appearance, glandular and papillary growth pattern. Tumor cells are large, highly pleomorphic with moderate amount of amphiphilic cytoplasm and indistinct cell membrane, frequent prominent nuclear overlapping, frequent mitosis and apoptosis, large area of necrosis and hemorrhage. Next tumor is yolk sac tumor. Tumor resemble extraembryonic structure اللي هما اليوك sac. 95% of patients they will have elevated alpha fetoprotein. This is very important. 50% of the tumor resemble endodermal sinus and they form shell duval body. نوريكم picture shell duval. This is very characteristic. واليوك sac tumor هذا the same يوك sac tumor اللي حنشوفوه في الأوفري في الفيميل genital tract tumor. Yolk sac tumor, there's two types, pre-pubertal and post-pubertal. Pre-pubertal يعني usually happen in the children up to 3 years old. While post-pubertal are usually happening with the mixed germ cell tumor. This is an example of gel duval body. عند هذا الشكل like glomeruloid like structure. عندنا blood vessels في النص وعندنا layer of epithelioid or malignant epithelium. واحدة هنا هذه هي واحدة تانية هنا. This is just remember this gel duval body glomeruloid لأنها تشبه الجلوميرولاي لكن هي مش glomeruloid. Glomeruloid gel duval body. Choriocarcinoma. Choriocarcinoma is a tissue tumor type of malignant tumor resembling placental tissue. The choriocarcinoma, it's highly malignant type of tumor. It's associated with very high HCG. A very aggressive germ cell tumor presented with widespread metastasis. Hemorrhage and necrosis is extremely common. المورفولوجي لازم بيكون composed من two component trophoblast and syncytial trophoblast. We have to have those two cells to call it choriocarcinoma. This is a gross picture of choriocarcinoma. This is a testicular tissue. This is the normal testicular parenchyma, and we can see a cut surface of tumor. It's dark blue with hemorrhagic area of congestion with irregular border. This is a gross picture of choriocarcinoma. The histologic feature of choriocarcinoma composed of those epithelioid sheets of cells with prominent pleomorphism. Some of those cells are large with multinucleation, those accounting for syncytial trophoblast and other cells composed of monocells as cytotrophoblasts. Teratoma. Teratoma, it's malignant in the male genital tract tumor. It's benign in a female. Teratoma in male, if it's mature or immature, it's malignant neoplasm. Teratoma, it's a germ cell tumor arising from fetal tissue for one or more than one layer of germ cell, including ectoderm, mesoderm, and endoderm. This is a low power view of testicular teratoma showing respiratory lining epithelium and adjacent cartilage. This is a respiratory lining epithelium and the cartilage. Mixed germ cell tumor. Mixed germ cell tumor accounting for about 60% of all germ cell tumor in the testicle. So mixed germ cell tumor from the name يعني هو بتكون من أكثر من نوع من germ cell tumor. يعني can be seminoma with embryonal carcinoma, seminoma, embryonal, choreo, and yolk sac tumor, or the fourth type, embryonal seminoma, yolk sac, choriocarcinoma, and teratoma. This is a gross picture, shows like mixed germ cell tumor. At the border we can see the normal looking compressed testicular parenchyma, وعندنا tumor focal, it's necrotic and hemorrhagic, the background looks very homogeneous and with no necrosis and hemorrhage. يعني هذا tumor composed of seminoma and non-seminoma component. Tumor arising from the 6 cord stroma. يعني هدو ما حيكونوا arising from large interstitial cells وإلا from the Sertoli cells. The majority of those tumor has benign behavior. عندنا هذه seminiferous tubule، عندنا السرتولي cells اللي هم supporting cells within the seminiferous tubule، وفي interstitial cells وعندنا Leydig cells. يعني tumor either arising from Sertoli cells ولا from the Leydig cells. Leydig cell tumor, it's a pure testicular stromal tumor composed of cells that resemble normal interstitial Leydig cells. Most common type of 6 cord stromal tumor, benign behavior, can arise in children or adults, can produce testosterone and associated with precocious puberty and gynecomastia. It's characteristically with rod-shaped crystalloid of Franke seen in 25% of the tumor. Sertoli cell tumor, it's the second most common 6 cord stromal tumor after Leydig cell tumor. Usually occurred in patients with undescended testes, Pettis-Jeghers syndrome and Carney syndrome. Most Sertoli cell tumor are hormonally silent and presents as a testicular mass with benign behavior. Just like as an high yield, we will go briefly over the Carney syndrome. رح نتكلم شوية على الكارني syndrome وعلى clinical manifestation of Carney syndrome. Carney syndrome is an autosomal dominant tumor syndrome caused by PRKAR1A mutations. مش لازم تركزوا فيها هذه الميوتيشن، بس أعرفوا إنه هو عبارة عن germline mutation lead to autosomal dominant tumor syndrome. The clinical manifestation, the most common clinical manifestation of Carney syndrome is the spotty skin pigmentation, usually في mucosal surface like lip, conjunctiva, canthi, and genital mucosa. Myxomatosis في cutaneous myxoma or cardiac myxomas. Primary pigmented nodular adrenocortical disease. Acromegaly due to growth hormone producing adenoma. Schwannomas and multiple other endocrine and non-endocrine neoplasm like thyroid. testis زي ما قلنا يكون في الليدك ديزيز، في سيرتولي سيل ديزيز، وفي الأوفري. testicular lymphoma. Testicular lymphoma, it's accounting about 5% of all testicular neoplasm. It's the most common testicular tumor in men over age of 60. The gross picture of testicular lymphoma, it's the cut surface of testicular lymphoma will be a mass in the testicular parenchyma resembling lymph node parenchyma. يعني بتكون tan white homogeneous fleshy tumor with infiltration and regular border. We can appreciate some area of necrosis and hemorrhage. This is area of necrosis and hemorrhage. This is adjacent normal testicular parenchyma. Frequently bilateral and high propensity to can go to the central nervous system metastasis. Microscopically, this is atrophic testicular parenchyma. Those are seminiferous tubule, and this is the interstitium. And this is testicular lymphoma. We can see the lymphocyte infiltrate between the seminiferous tubule. Thank you for your attention. Those are the reference, and let me know if you have any question. لو عندكم أي سؤال تقدروا تبعتولي على الجروب هذه في الفيسبوك. Thank you.